104 students. I just wanted to do a quick recap of the week 10 assignment, which was following on the lecture on the zoonotic diseases of the small animal kennel facilities. So that lecture is meant to kind of recap things that you're probably learning in parasitology and other lectures, but it was supposed to kind of highlight some of those things and just a refresher. Because obviously all of those things tie in together. So we teach you about things in parasitology so that they correlate to small animal care and they correlate to Vets 104 or husbandry duties. If you don't understand the diseases that small animals can get, then taking care of them in a small animal clinic setting or in a kennel facility, or sometimes they're combined together depending on where you work, is a little difficult. So we do have to, as licensed veterinary technicians, we need to understand these diseases. We need to understand how they're transmitted, how to prevent them, how to handle those patients properly, how to treat them, things like that. And you, as a technician, will end up teaching other staff members, whether it's your kennel assistants or your veterinary assistants or interns in the future. So you need to understand these so that A, you're giving the best quality of care to the patients that are staying with you, as well as teaching other people that you work with. You're also going to be teaching clients because most clients have no idea what zoonotic diseases are. So we do spend a fair amount of time educating our clients as to what things they can get from their pets or give to their pets. So definitely understanding those, because if you're diagnosing their pet with one of these diseases, you need to kind of go through this simplified list with them as well. They need to know how to treat them or handle them, or what precautions they need to have so that they're not spreading it to the rest of their family or to their other pets that they may have. So on the screen here I have an example of one of the flyers or cage signs that I asked you guys to make. This is one of our students, but I've taken her name off of there. I'm sure she knows who it is. But I thought this one was a really nice one. Kind of flashy. Doesn't obviously have to have a picture of the animal because usually there would be in the cage, but for this purpose it was kind of nice to put that with the information. So on the side it has the animal's information and signament. It's a caution, type zoonotic disease in red on top. Bold letters right at the beginning. Disease is Giardia. The symptoms may include vomiting, diarrhea, weight loss. So those are things that we're visibly going to be looking at for this patient as we treat it. Just kind of reminders of what the common symptoms are. Precautions: using PPE, using gloves to clean up the waste from the animal, washing your hands right after handling the patient. Okay. Handling, keeping this animal away from other patients, making sure their feces stay away from other patients because it's going to transmit through feces. So if you don't clean properly, the next pet in this cage could potentially come down with it. Cleaning, use PPE when cleaning the cage and cleaning up the patient. So it's definitely protecting ourselves, but we also need to do proper cleaning protocols like contact time, right? Washing all the bedding that this animal has slept on thoroughly so that we're not transmitting more disease to the next patient. Feeding. Obviously, this animal is probably on medication, so it looks like it's giving metronidazole with food. Always providing clean water. And then walking, using PPE while you're walking, cleaning up the feces or vomitus immediately after it happens, disinfecting that area. Obviously, if it's outside, you're going to have different disinfectant protocols depending on what your hospital has. If you're walking it on grass, you're not going to go out and necessarily bleach the grass, but you may have an area of your clinic where you walk animals that have zoonotic diseases, and you don't walk your normal healthy kennel animals in the same area. Definitely, obviously, cleaning right up after them is the best policy because then it's not sitting and it's not infecting that ground any further. So this is just an example of one of those. There was a couple other really good ones. I think overall everyone did a really great job. I'm really impressed. These are definitely things that you will use in practice, and you will be able to use this information further down the road. Obviously, you're going to tailor it to the patient and your facility, but just having an idea of something like this is really eye-catchy. It helps, especially if you have multiple shifts of people coming on, because as shifts change, the information doesn't always change over. A lot of clinics do rounds when each shift changes so that everybody's on board, but this is just really helpful for the new people coming in to see what's going on. So great job on that, everyone. So looking at, I wanted to just do a quick review on the quiz, quiz 2 that was just up. There was one question, question number 3, that a couple people emailed me about because the wording was weird. So I went back and looked at it, and I want to review it and just let you know what I did. So question number 3 is right here on the screen. It says ear tags and microchips are both forms of permanent identification. And this is a true false. So breaking this down, ear tags and microchips, are they both forms of permanent identification? No, this is actually a false. So if you answered this question as false, you were actually correct. I know it was a little confusing. So, just to explain, ear tags are tags that are punched through the ear. So cows wear them a lot. We use them in rodents sometimes. Not real common in dogs and cats. But those types of identification are not permanent because they can fall out, and a lot of times they do fall out. They loosen up and they fall out. So ear tags are not permanent. Ear tattoos would be permanent. So it might be just how you read the question or how you interpreted it. Microchips obviously are permanent because they're a device implanted under the skin that stays with the animal. Okay, so the answer to this question was false, knowing that ear tags are not permanent identification. What I did, because I know it was a little confusing to a few people, I went back through and I regraded that question, and so I gave everybody who answered it incorrectly the points for it. So everybody got question 3 correct in some sort of manner. So I've adjusted all your grades. So if you originally thought that you got it wrong, add that 1 point back onto your grade, and that brought your grade up 1 point. So everybody got that question correct. If you had already answered it the way it was supposed to be, then you're good. So I just want to let you know, kind of regraded that question. If there's any other questions on the quiz, this is quiz 2, some of the overview of the questions. If there's any other questions on there, please feel free to reach out to me and I can go over them. But I think everybody actually did really well on quiz 2 and I was impressed. So good job. Thank you for reading through the things and taking your time and answering the questions. I am going to do a quiz 3, and that will be next week. I'm going to try to get it uploaded by the end of this week, so it will open this weekend and be open for a couple days. I haven't posted it yet. It's going to be a short quiz. I'm not going to lie. I'm kind of busy and I don't have a lot of time to create a big long quiz, and I know you have a lot of other final exams to worry about. And we have 2 assignments that are due by next week. So both week 13 and week 14 case studies are due by the 15th. Please make sure you do them, okay? They don't need to be anything crazy. They don't have to be 100% correct. I just want to make sure that you are attempting them. So on the questions, read the scenario, answer questions 1 through, 6 on case study 1. You don't have to retype all this, just give me your responses so I can read through them very quickly. And upload those in a Word document. Okay? Don't worry if you're not 100% correct. It's okay. I'm just kind of making sure you can kind of use your brain and find some inferences from small animal care and what you've learned so far. Same thing with case study number 2. Same idea. Just reading the scenario and answering the questions. Okay, there's 6 questions there. So please just make sure you do those because they are a decent chunk of your grade, and I don't want that to affect your grade negatively. So please, please, please just attempt them, do them. I will grade based on kind of the style of your responses. If you did a good attempt, you'll get points, full points for it, or almost full points. If it didn't look like you really attempted it at all and you just kind of blah, blah, blah'd it, then you're going to get partial points. So I will post the quiz 3 next week, or by this weekend, hopefully. It will probably be a 5-question quiz, but it is worth points, and you must log in and take the quiz. I'm going to tell you it's going to be really easy, okay? But just please do it so that we can get the grade for this course and you can be done. No one wants to fail this course because of not taking these exams or the assignments. If you have questions, please, please, please reach out to me. It's been a joy having you all this semester, even though it's kind of a weird end to our semester, and hopefully you took away a lot of key concepts from this course. You will be revisiting some of this stuff in next year. In VETS 204, you will be doing a weekly kennel duty rotation like the second years that worked with you this year, but you won't have to do weekend kennel duty next year. So just keep that in mind. We'll see each other again, and we will rely on you as second year students to help guide the first year students next year in knowing what to do. And I know it was kind of a weird semester. You probably were just starting to get the hang of it, and then we changed the scenario, but I think you guys had a decent grasp of things. You guys seemed to do really, really well in your groups, and you were communicating well. We had less and less issues that were posted up on the board. So I think just keep up the good work, keep up the communication moving forward, and you will do fine. Thanks a lot, everyone.